Have you ever been really stressed out or have just had one of those days, then listened to one of your favorite songs and suddenly felt better? I know I have. Music has always been said to be very therapeutic, but most of us never think twice about the neuroscience behind it. After doing much reading on the topic, I can say with credibility that music has proven to have many positive side effects on the brain. This is leading scientists and other professionals to take a deeper look into the field of music therapy. Steps involved in learning about the process of music therapy include learning about how music affects the brain, looking at music therapy as a health profession, and seeing examples of how it has already helped many individuals. First, some background information on how music affects the brain. According to Leah Steakley's article posted on Stanford Medicine's website, research shows that listening to music releases a neurotransmitter into the brain known as dopamine. When dopamine is released, it sends pleasure signals throughout the body. Music is also processed in more than one area of the brain. Researchers have discovered that it affects the auditory, motor, and limbic areas, thus playing a role in neural networks, movement, emotion, and creativity. A study done at Stanford also shows that music engages parts of the brain that allow us to pay attention, make predictions, and update the event in memory. In addition, music has shown to help the brain organize incoming information. It is evident that music is not simply a right brain activity, but affects many areas in unique ways. This is where the health profession of music therapy comes into play. In the frequently asked questions section of the World Federation of Music Therapy's website, Dr. Annie Heiderscheit defines music therapy as the professional use of music and its elements as an intervention in medical, educational, and everyday environments to optimize quality of life, improve physical, social, communicative, emotional, intellectual, and spiritual health and well-being. Basically, what this wordy definition is saying is that music therapy is established as a health profession in which different types of music are used therapeutically to help the mental as well as physical needs of individuals. Degrees can be earned in the allied health profession of music therapy, and many who earn this degree are employed in places such as psychiatric hospitals, rehabilitation centers, nursing homes, daycares, and other private practices. Other places that are now starting to employ music therapists include hospice care, pain and stress management clinics, substance abuse programs, and even correctional settings. Many of these therapists also work in special education settings as consultants for educators and sometimes even get to provide direct services to students with disabilities. As you can see, there are many employment opportunities in the field of music therapy. Now let's look at who really benefits from this field. In the April 2010 article, Does Music Therapy Really Work? Evidence and Facts from a Psychiatrist, found at FamilyDoctorMag.com, psychiatrist Scott Holtzman states that cancer patients report less anxiety, nausea, and pain in the initial phases of treatment when they are given music therapy in addition to their chemotherapy treatments. Music therapy is known to lower blood pressure, reduce anxiety, improve sleep, and when used in addition to regular treatment can be extremely beneficial to patients. This method of music therapy has virtually no risk of bad side effects, therefore it can do nothing but help the patient. One inspiring video clip found on YouTube entitled Gabby Gifford's Finding Voice Through Music Therapy shows U.S. Representative Gabrielle Gifford's struggle of going through speech therapy after being shot in the head during an assassination attempt. The left side of Gifford's brain was severely affected, and she had to learn to speak and read all over again. I'll show you the video.
Early therapy sessions in Houston, it seemed as though words had abandoned her. For those of us injured on the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Yeah, are you frustrated? Can I tell you something? It is going to get better. Okay? It's frustrating right now, but it is going to get better. You've come a long way in 5 weeks. You've come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're going to do this. You ready? This little light of mine, I'm never sure to shine.
remember at this point she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine. Excellent.
Alright, as you can see from this clip, Giffords is undergoing speech therapy and begins to get frustrated and emotional when she struggles to say the word light. After consoling Giffords, her speech therapist suggests that they sing This Little Light of Mine to relieve some stress. With the speech therapist leading her in song, Giffords sings the word light, as well as multiple other words without much trouble. So why can Giffords sing the word light but not say it? Her music therapist goes on to explain that music affects both sides of the brain. So although Giffords struggles using the damaged left side of her brain to speak certain words, music and singing allow her to communicate using different areas of the brain. Scientists are realizing that music may become an essential step in rehabilitation of language. It is evident that many different types of patients, especially those struggling with communication, can benefit from this profession. In conclusion, music therapy is definitely an extremely beneficial practice today and is growing rapidly. Music deeply affects our brain, which can improve the way we think. This sparked the idea of music as a form of therapy and created many employment opportunities in its allied health profession. This health profession has touched the lives of many patients and other individuals, encouraging them to improve their health and quality of life. Music therapy has also been vital in rehabilitating patients to learn to speak and read. I hope you now have a better understanding of music therapy and knowing the science behind it, how it works, and who it helps. Now we can all take a moment to be thankful for music and its endlessly life-saving effects. Thank you.